So in general, so with UT Southwestern, we're very active in research overall. We've been a very heavy clinical trial site since we have a very broad myeloma population base. And so we've been very active in several realms of clinical research from phases 1 through 3. In my own case, what I'm interested in is also myeloma epidemiology, which has been an up-and-coming field with several studies coming out of the Dana-Farber system, the Iceland system, and others. And one thing that I'm looking at is using HealthTree, the access to patients to look at certain outcomes that patients self-report as being problematic. One thing that we're looking at is sexual outcomes with myeloma. Something else that we're looking at is real-world data. So the Flatiron database and SEER Medicare databases have a lot of very excellent real-world data on what happens to myeloma patients from diagnosis all the way to death. And we're trying to look more and more at what we can figure out in terms of patients' actual clinical courses are, as opposed to what we know from clinical trial data, and trying to see some of the discrepancies there. With the upcoming American Society of Hematology meeting coming up just next month, one of our papers, for instance, in that realm is being presented as an oral, and that's looking at the real-world outcomes of bortezomib use compared to clinical trial data using the Flatiron database. And so it's a very rich field. It's one in which I think we have a lot of data and a lot of questions that are low-hanging fruit, and so we're trying to pursue those.